see people coming in, so that's great. Hello, everyone. Thank you very much for joining us. We're just wait with us for just another minute while we allow people to join. We're just waiting for people to follow the link and things, and then we'll start in just about a minute. Thank you. Okay. Thank you, everyone. So welcome to this to today's webinar. My name's Jamie Bridge. I'm the chair of the Vienna NGO Committee on Drugs, and we're really pleased to be hosting this alongside the Unodc HIV/AIDS section, and really to have a focused discussion on some of the developments around Unodc's work around HIV/AIDS. But also around their partnerships with civil society and the broader developments that have been happening in the last 12 months around these topics. So really appreciate the opportunity to have this webinar, and thank you everyone for joining us. Before we get started, just a few housekeeping things. So we have the Q&A box open, so you can post a question to any of our speakers at any time today. Please put it in the Q&A and we'll pick it up from there. Some of the speakers might be able to respond in writing, and other questions we can raise those at the end. There will be time at the end for questions, but please also use the chat box. I can see some colleagues have already started. Please do use the chat box to introduce yourselves as well. You're very welcome to do that so that people can see who else is in the meeting. And just to say as well that we have translation today. So at the bottom of your Zoom screen, you should hopefully see a logo, an icon says interpretation, and you can choose there between English, French, Spanish, or Russian. And I'd like to thank in advance our translators for being with us today. And please use those translations if you'd rather follow today's discussion in any of those other languages. So just quickly, before I hand over to our wonderful Unodc colleagues, just to introduce, for those who may not know us, the Vienna NGO Committee. We are a global network representing around 300 NGOs, and our main role is to provide the link between civil society in every country, linking them with the United Nations processes on drugs. So the UN Commission on Narcotics Drugs in Vienna, but also the work of UNODC and other UN agencies that relate to drugs. So things like this webinar are something that we've obviously started to do more in the last year or 2 years for obvious reasons. But they've been really successful. So far, we've had similar webinars hosted with the UNODC Prevention, Treatment, Rehabilitation section, but also with other parts of the UNODC, including their data collection units, and we hope it's a series of events that we're looking to continue over time, and just to introduce civil society to the different bits of work that UNODC is doing, and crucially to learn about how we can be more involved as the NGO community. And so that's what we're going to try to do today with a focus on the HIV/AIDS work. So without further ado, I'll hand straight over to Fariba Sultani, who is the head of the HIV/AIDS section at UNODC, based in Vienna. Fariba is joined today by a number of her colleagues, and they're collectively going to run us through the work that they do as a HIV/AIDS section. And then after that, we're going to hear from some of our civil society colleagues on the call, who are going to tell us a bit more about how, as civil society representatives, they have been engaged in the work with the UNODC on HIV/AIDS and also on prisons as well. So yeah, without further ado, Fariba, the floor is yours. Thank you so much.
Thank you very much, Jamie, and thank you to the Vienna NGO Committee for organizing this webinar and allowing this discussion to happen with the civil society partners. It is really very much appreciated by us from the HIV/AIDS section. We have a very good working relationship, of course, with you and also with our civil society partners, which we are very, very proud of. And it's really great to have this opportunity to talk to our civil society partners about the new developments that have happened in the global HIV/AIDS world recently. So there we are all on the same page and we are all updated about what is happening globally. And we also thought it would be nice for people who maybe are not so familiar with our work to actually get a glimpse of what we are doing. And I've asked my colleagues to join me so that you don't only hear my voice. I think it's much more interesting to hear from our substantive colleagues about the work that they're doing. And of course, I would have asked our global team to also interact and provide inputs, but the time is very limited, and I think many are going to be on the in the webinar, and they can also pitch in and provide information from their regions and countries if any questions arise. So we've prepared a short presentation for you, which Irina has kindly put on the screen. So we are going to just, can you, Irina, please go into the next slide, please? So this is just to show that we have global commitments on working on HIV/AIDS issues, not only for UNODC, but for the UN Joint Program on HIV/AIDS as a whole. And we have the 2030 Agenda for Sustainable Development Goals, and you see some of the goals which are really more tailored to the work that we are doing. We have the new Global AIDS Strategy, which I will be going into a bit more detail about the substance of it and how it relates to the work that we are doing. We also have an UNODC strategy, which again has been finalized this year. And I can also give you a bit of background on what it entails for the work that we are doing. And of course, the UNGAS 2016 outcome document, which guides us, guides our work since 2016 and has a very strong it has a strong component on the work that our HIV/AIDS mandates that we do within UNODC. Next slide, please. So the UNODC, we have a new UNODC strategy 2021 to 2025. And through this this strategy, we want to support the member state to scale up HIV/AIDS prevention, treatment and care, focusing on people who use drugs and those in prisons and other closed settings. And this strategy it has been adopted for the next 5 years and will equip us to deliver effectively and efficiently with accountability to our member states to build just, inclusive and resilient societies and to leave no one behind. And as UNODC, we are a co-sponsor of the joint United Nations program on HIV and AIDS. And we support member states, as written on the slide, to scale up HIV prevention, treatment and care for people who use drugs and people in prisons. And this is the focus for our program under the UNODC strategy. So next slide, please. And we have also the Global AIDS Strategy, which was adopted by the Program Coordinating Board of UNAIDS in March this year, 25th of March this year. And this Global AIDS Strategy forms again the blueprint of the work that we are doing. And as you see, it's the Global AIDS Strategy. It's not just for the UN, but it's for everyone, all stakeholders working on HIV and AIDS globally. So, and there was a lot of consultation with different stakeholders. The civil society partners were very much involved in the development. So I think we all own this strategy equally from our side, from the UN side, from the national government side, and also from the civil society side. And as you can see here, it has a very strong inequalities lens. It has a very strong focus on HIV combination prevention. And we have 2025 ambitious targets and commitments that we've set out for ourselves. Of course, we need to make sure that the resource needs are there. And it has a strong focus on cross-cutting issues, which are work with the communities, on human rights, on youth, humanitarian settings, and of course the pandemics, as we have all been grappling with the COVID-19 pandemic in the past year. So next slide, please. Here. So the Global AIDS Strategy has 3 strategic priorities. And these are to maximize equitable and equal access to comprehensive people-centered HIV services. The second strategic priority is to break down legal and societal barriers to achieving HIV outcomes. And third, as I mentioned in the slide before, to have a fully resourced and sustained HIV responses and integrate them into systems for health, social protection, and humanitarian settings. Next one, please. This slide is a bit busy, so I don't expect you to read everything, but we just put this in there because I wanted you to see how it's connected to the Sustainable Development Goals. It is connected to the visions of the zero discrimination, zero new HIV infection, and zero AIDS-related deaths, and which lead to ending AIDS as a public health threat by 2030. And as I mentioned, it acknowledges the pressing challenges and opportunities, recognizing key shifts that are needed to end AIDS through this, our new global AIDS strategy. It is aligned to the decade of action and makes explicit contribution to advanced goals and targets across the 10 SDGs. It keeps people at the center to ensure they benefit from services, to remove social and structural barriers that prevent people from accessing HIV services, and calls on governments and development and financing partners and communities and the UNAIDS to identify and address these inequalities. So this shows you we have 10 results areas, and it shows you how it is all sort of coming together with a focus on an inequalities lens to confront the disparities. So next one, please. And these are the ambitious targets that we have set ourselves for 2025. As you see, you know, it's 95% of people at risk of HIV use combination prevention. I'm not going to go through all of these because, you know, you probably have access. You can find the strategy and all the goals and targets on the UNAIDS website, and we can also share the document with you in the chat if you haven't managed to have a look at it already. But these are the ambitious goals and targets we've set ourselves by 2025. So there isn't much time really. We really need to pull ourselves together in order to achieve these very ambitious targets. Next, please. Another new development this year was the adoption of the political declaration on HIV/AIDS, ending inequalities and getting on track to end AIDS by 2030. And this was adopted by at the UN General Assembly high-level meeting in June this year. And this again has a very strong focus on key population and what we need to do on HIV prevention to ensure that key population, that they receive the services that they need, and with that we do reach the targets that we have set ourselves up for getting on track to end AIDS by 2030. And it also has a very strong focus on community leadership and community involvement. So this is another, you know, how do you say, commitment from countries, from the governments to actually make sure we reach the goals of ending HIV by 2030. So next, please. Yes, this slide, I just want to show you a little bit of the situation of where we are. And as you can see, 65% of new HIV infections globally are among key populations. And as you can see in the orange part of this chart, that 9% are among people who inject drugs. People who inject drugs are 35 times have a greater risk of acquiring HIV infection than people who do not inject drugs. So we really need to work together to make sure that we get the prevention services out and at scale to really address this. And HIV prevalence among people in prisons is 4.3%. such that people in prisons are 6 times more likely to be living with HIV as compared with adults in the general population. Next, please, Irina. Yes. So in order to address all these issues, we have a Unodc Hiv section. This is we were established 20 years ago, actually, already. And we have a small team of working here in Vienna headquarters, but a larger network of regional and country advisors who cover our high priority countries. And you see in the pictures a range of the works that we do, for people who use drugs and also in prison settings. And in the different countries and regions, you get a taste of the work that is happening within our global team. Next one, please. And we have, in order to be able to really focus our attention on the work that we're doing, we have concentrated our efforts and resources in 24 high priority countries for people who use drugs and 35 high priority countries in prisons. And what we do is we engage key in-country stakeholders, we identify bottlenecks and challenges in scaling up and develop prioritized work plan for each of our high priority countries. And in the box, the blue box on the side, you see our partners who we work with at the country level. Of course, we work with the Ministries of Justice, Interior and Health, National Drug Control Agencies, national AIDS programs, law enforcement agencies, prison administration. As I mentioned earlier, very much so with us, we depend on our civil society and community partners. We have even a joint work plan, but we will come to this a bit later on. And of course, with our UN partners and donors. So these are our partners and these are who we try to bring on board and around the table when we're discussing HIV. And some of these people, of these partners are actually usually not a part of the discussion at the country level. So it's very important, for example, especially if you want to deal with the national policies on drugs and the prison administration, to have the national drug control agencies, the law enforcement agencies, the prison administrations around the table to make sure they are also a part of the solution of when we are working on the HIV responses at country level. So next, please. So I want to give the floor now to my colleague, Monica Chpajea, who is our expert on drugs and HIV. So she will give you some of the new developments of the work that she is leading within our team. So Monica, please, you have the floor.
Thank you very much. Thank you very much, Fariba. Welcome everyone to this webinar. I'm really happy that we have the opportunity to talk a little bit about our work with you, and also to find out what you are interested in. Well, as Fariba mentioned, one of our pillars is the work on drug use and HIV. And also, as she said, we have 24 high priority countries countries that were selected in collaboration with our civil society group. And these are countries that have high prevalence of drug use, high prevalence of HIV among the people who use drugs, but also political readiness to implement harm reduction measures. So in these countries, we have activities either funded through agreements with bilateral partners or through the funding received from the UNAIDS joint program, what we call the country envelopes. So in these countries, we did a very, and we are continuing actually to do a very clear research to understand what are the needs, what are the priorities, and where are the bottlenecks. And we are trying to focus to scale up the access to harm reduction services for people who inject drugs, and also for people who do not inject drugs, who use stimulant drugs. As I said, 24 high priority countries. This doesn't mean that we don't address requests from other countries. We do, but you know, for the amount of funding that we have available, we can efficiently concentrate our efforts in these 24 high priority countries. Another initiative that we have is what you see there in the slide, the two publications on top, is to address the needs of women who use drugs. This is another initiative that was generated in the UNODC civil society group for drug use and HIV. And we are trying to provide technical guidance and to build the capacity, and also to provide small grants to facilitate the access of women to harm reduction services. Something that came, one thing that is quite evident everywhere in the world is that the services, the harm reduction services, wherever they exist, were tailored to meet the needs of male clients. So there are special steps that needs to be taken in order to facilitate the access of women who use drugs, but also make them feel comfortable. Look at all other needs that they might have, with the children, with reproductive health, and others. These two publications are available on our website. One is talking about addressing the needs of women who use drugs in general. And the second one, the most recent publication, is one that is looking into increasing access to prevention of mother-to-child transmission. And why we did this, prevention from mother-to-child transmission is a target that is met by many countries, but the small percentage of women who are not reached by these services, that 15% that it's left out, consist of women from key population, especially women who use drugs. Another initiative also generated in the civil society group is to look into the HIV prevention, treatment, and care for people who use stimulant drugs, because we noticed that there is a change in the way people are using drugs or combining the drugs. So it's obvious that more and more people are using stimulant drugs, or the combination of opioids and stimulants. So we looked into this problem. We provided some technical guidance in the blue publication that you see on the screen, but also we developed a very good capacity building program that can be used both online and in face-to-face meeting to build the capacity of the service providers to provide these services for people who use stimulant drugs, because most often they will not go to the traditional harm reduction services, if we can use the word traditional, because they are addressing more the needs of people who are using opioids. As you heard, I've mentioned many times the civil society group for drug use and HIV, and you see there one of our photos when it was possible to have large meetings in person. Hopefully next year we will have a fresh photo, because in the last year we had a screenshot and I didn't want to show that. The civil society group for drug use and HIV was established in 2013. And since then, so we are slowly approaching 10 years. Since then, we are working very close together. We have an annual meeting around the CND to provide the opportunity for the members also to observe how the CND is taking place. And in this meeting, we agree on a work plan, and we agree on priorities, and we talk about the progress made in the high priority countries. And I have to say that this collaboration, is getting stronger and stronger. Now we have representation from all the geographical region in the group, and there are members from all the geographical networks who are networks of people who use drugs. And as you can see also in the slide, the initiatives that came out of this collaboration are the most important initiatives that we implement. One thing that we did together was to develop this guidance on how to implement harm reduction services with and for the community, and this is the publication with the hands. We call it I Do It, and this is something that we are implementing in parallel, both to build the capacity of our colleagues and the service providers that are our grantees, but also to build the capacity of the community-led organizations to implement harm reduction services and be part of the process from the beginning, from the moment the legislation is developed till the moment people are coming in large number to the service and receiving the needles or other commodities that are available there. So I will stop here to leave some time for my colleagues to talk about our other initiatives in prisons and with working with law enforcement. Thank you very much.
Thank you very much, Monica. Thank you. So now I would like to ask my colleague, Ihab Salah, who is our prison expert, to provide you with a little briefing on the work we're doing on prisons and HIV. Thank you, Ihab, please. You've got...
Thank you very much, Fariba, and thanks everyone on the call. Thanks for having me. I think this is a very important briefing. I'm very excited to be with you. I will talk about people in prison and HIV in 5 minutes. I don't know, that's not easy, but I'll try to do my best to squeeze it in 5 minutes. In Fariba's presentation, she was talking about that key populations, they have the majority of the new HIV cases in 2019. This is how the key populations are left behind, including people in prison. And here I'm talking about one of the population that has been systematically neglected in the global and national HIV response. So as you can see here, we are talking about the number of people in prison, which is 12 million people in any given day. That's our target population. But why we say it's per day? Because the turnover is high. So if we start to talk about our target population in a calendar year, some experts estimated that here we're talking about more than 30 million people. And this gives us an idea about the turnover in and out of prison settings. And also there is no clear separation between prison and the community. They are one big community. People come in and out as prisoners or visitors, service providers, staff working there, catering companies, and all of that. So we're talking about a big number of people that has been systematically neglected for a long time. And sorry to say that, but definitely when COVID-19 hit the wall early in 2020, late in 2019, that was hitting prisons very hard. And you will see that people in prison was very, very much exposed to COVID-19, and also telling us about the health system inside these closed settings as well. Again, so you will see that the prevalence of HIV, this data we have is kind of recent. So recent data we have is telling us that the prevalence of HIV among people in prison is 4.3%. This is 2020 data of the Global AIDS Monitoring. And before, when we collected this and reported this in 2017, it was 3.8%. This means that this number is getting higher and higher. Not speaking about the prevalence of HIV among women in prison, which is again higher, it comes up with 5.2%. HCV, hepatitis C virus, is very high in prison settings as well. You'll see 15.1% living with hepatitis C virus, 4.8% living with hepatitis B virus. This data from 2016 from a systematic review all over the world. So this is where we are. What about COVID-19? I think no clear data about how many cases reported COVID-19 in prisons. In July this year, there was a report indicating that more than 500,000 people tested positive by PCR in prison settings. Think about this 500,000 people compared to the 12 million will give you an idea about the high prevalence of COVID-19 in prison compared to the community. As mentioned before, we support a set of high priority countries. We have 35 countries right now to develop and implement evidence-based, public health-oriented, gender-responsive HIV prevention, treatment, and care in prison settings as well. We do this in a systematic way, and the first thing we do is the advocacy. And we advocate and promote the international standards, as Fariba mentioned, like the political declaration, the strategies we have, and also we have prison-specific international tools like the Nelson Mandela rules and the Bangkok rules, which is the United Nations Standard Minimum Rules for the treatment of prisoners that has been adopted by the General Assembly in 2015. So it's agreed upon by the political leaders and world leaders to provide healthcare service in prisons that should be equivalent to those provided in the community. The second thing is we do try to help countries to get data, strategic information in prison settings. This is also very important because one of the gaps is data. So what we do is we have a tool, we develop a generic tool that's adapted to the national context, and then we help countries to generate data about the epidemiological situation and service coverage, the quality, availability of services, and all of that. We also do support countries to develop strategies. We also help them to develop standard operating procedures, ensuring continuity of care, linkages with community healthcare facilities. We conduct capacity building workshops with countries using our tools, like we updated our comprehensive package for HIV in prison in 2020. Then we started now to train trainers at the country and regional level to provide quality HIV services for people in prison. Now we started slowly to work after the release of some COVID measures. We started to travel, and we do things in person. We also do things virtually so far. Gender perspective is very important, and we focus on women in prison. Women represent 7% of the total prison population. However, they are always neglected or left behind in the response. And this is why we also work to shed some light on the specific health needs of women in prison settings. We developed some technical guides on this regard, including prevention of mother-to-child transmission of HIV. And also we work to help monitoring and evaluation of HIV services in prison. And yeah, in closing, yes, we have done a lot when it comes to people in prison and HIV. We still have so many challenges right now, including resources. It's always limited resources in prison. And again, COVID-19 has exposed the situation. Gender stigma and discrimination is always a challenge, and definitely civil society organization and the community. I would say that, yes, we have taken some steps in the development of the first informal group of civil society organizations working on HIV in prison settings. However, we still have a long way to go. We've taken the first step, but with your support, I think we will be able to reach our targets by 2025. Thank you very much, and back to you, Fariba.
Thank you. I think we've run out of time, and we have taken more time than allocated to us so quickly. Just, Irina, can you go to the next slide? Yes, I just want to touch on the issue of the work that we are doing on law enforcement, because this is another pillar of our work, law enforcement, and what we're doing together to bring together law enforcement and our civil society partners to hear each other out. As I mentioned earlier, law enforcement is one sector that is systematically left out of the discussions on HIV response at country level. So these are some of the work that we are doing. Irina, can you go to the next slide? And yes, we will be doing, we've got different documents that you can go to our website and you can see what we have already developed for law enforcement. Next one, I think that's it. And as both my colleagues, Monica and Hiv, have already mentioned, community leadership and involvement in our work is very, very important to us. You see just two of the activities here, one in Kenya, one in Vietnam, but this is just examples, and we are very much looking forward to hearing from you, and we're working more closely with all of you, both from here and from the countries and regions that you represent. Thank you very much, Jamie, for having us. Thank you.
Thanks so much, Fariba. Yeah, no, I really appreciate that. It's obviously an impossible task to summarize the work of a UN department in 20 minutes. So really appreciate all the information from all of you. There has been a question about whether we can share the slides. I assume, Fariba, that's okay, and we will do that. And obviously we're also recording today's session, so that will also be available for people afterwards if you want to recap. And then yeah, there was a question submitted about links to some of those documents in French. So I've shared the link to the Global AIDS Strategy and the UNODC strategy in French, so people can see that in the Q&A. I guess the presentation isn't available in French, no? Or is there another version of something like that available in French? No. Okay, not to worry. I thought I'd better double check. And then yeah, please do keep the Q&As coming, and our UNODC colleagues can maybe respond to some of those in writing as the session proceeds. So once again, thanks for the summary. And I think what we've got now is some presentations from the civil society side to elaborate on what Fariba and Monica and Hiv have told us, but to give some practical examples of how this partnership is really working in reality. So without further ado, I'd like to hand over first to Matt Southwell. Matt, I think you have slides that you're also going to share. So Matt is, on behalf of the International Drug Policy Consortium, Matt is the coordinator of the UNODC Civil Society Group on Drug Use and HIV, which Fariba and Monica mentioned earlier. So Matt, over to you to tell us a bit more about this platform and how it all works.
Thank you very much, Jamie, and thank you, colleagues, for inviting me to contribute to this important and interesting briefing about the work of UNODC's civil society engagement. And I'm very happy to have been involved in this journey that we've been on together over the last, well, nearly a decade now, 9 years, working together to strengthen civil society participation in the delivery of the global AIDS strategy, and particularly the global AIDS program at UNODC. So let me just explain to you what, I mean, Monica has already given quite a lot of information about some of the areas of work that we do together and the place of this program. So let me just give a sort of civil society view, adding to that without repeating the same issues again. So just in terms of the history of the mechanism, it started out with input representing drug civil society on the NGO delegation to the UNAIDS board. That was the first time a drug user activist had taken on that lead role within civil society, and it was within the PCB mechanism. And it was a key moment to learn how the system worked and also to forge new working relationships. That led to a commitment to work together and undertake a more formal mechanism of working together, and that led to this formation of the UNODC Civil Society Group on Drug Use and HIV, which was founded in 2013. And the mechanism was founded to bring together 20 regional and global networks. That was the ceiling we put on it in terms of the available funding. I think what's really exciting is that we're now having to deal with the challenge of now having already 25 networks and growing interest as networks develop in particularly the parts of the world where we maybe are slightly weaker in our representation and perspective. So so we have this growing mechanism to bring together those networks that specialize in drugs and HIV and the UNODC Global HIV Program. So it's slightly different from the much broader focus that you see in the Vienna Ngo Committee. This is really the specialist networks working around drugs and HIV. IDBC is funded to provide the secretariat, which is done on the equivalent of 4 days per month, and that function is shared by myself and also Daisy and Jamie within the IDBC team. So in terms of our membership, our members are a range of different stakeholders in the HIV response. So a critical group are the regional harm reduction networks, organisations like the Eurasian Harm Reduction Association, that bring together, network, capacitate, undertake joint advocacy, working with country harm reduction partners and also often drug user networks as well. So they have a really good perspective on what's going on at a country level. We also have important organisations like Harm Reduction International, harm reduction advocacy organisations that are playing more like think tank, advocacy, technical development roles in the system, and doing important work. For example, Harm Reduction International doing work on behalf of civil society to track the expenditure around harm reduction, which is a really critical part of the struggles that we're having to ensure adequate resourcing. We also have the key harm reduction programmers, Meds de Monde, Frontline AIDS, different stakeholders involved in delivering harm reduction programming. And as Monica mentioned, this very important part of the partnership, the fact that we have all of the global and regional drug user rights networks connected with this mechanism. And I think there's been a really strong partnership that you'll see flowing through this work that is founded in this partnership at a global level. And then we also have a number of thematic networks, one's focusing on police, law enforcement, focusing on women, focusing on the perspectives of drug policy and from the perspective of doctors. So lots of different stakeholders, youth representatives, ensuring that we can speak about the work of the harm reduction response from this diversity of perspectives. So what do? Well, we have a key role together to advocate for harm reduction and the rights of people who use drugs. We do this around a structured work plan that gives us a focused mechanism for agreeing what work we'll do together and then monitoring the delivery of that work. And then that work plan frames this formal partnership between the Unodc Global HIV Program and civil society, and wider UN partners, bringing us together as civil society to undertake different thematic or specialist projects. We also have a particular role monitoring the work of the high priority countries, which I'll come to, and importantly, and prior to the pandemic, a key part of our work was coming together for a day each year where we could talk together about the work, negotiate the work plan, discuss practical interventions, and I think importantly also just build those sort of human working relationships that allow us to understand each other and understand the limitations of each other's roles, to understand our red lines and our priorities, and just to get to know each other and understand how we come to this work and what motivates us to do this work. And I think the partnership has become stronger and stronger, and therefore easier and easier as time goes on. That doesn't mean that we are soft in our advocacy. It means we have healthy working processes, but we are robust in our communication with each other, as is as is appropriate in this type of mechanism. So what do? Let me just talk you through just some examples. We have a work plan that has 3 core areas. At the end of this presentation, I've included our full breakdown of members and the full work plan. So when we share the PowerPoint, you'll have access to them more detail, but let me just give a couple of examples. So one function we have is to focus on leadership from UNODC and to support meaningful participation of civil society, and and including people who use drugs. So noting particularly that the important engagement with those directly affected by the work and policy of UNODC. So one of the things that's flown through from this global partnership is a commitment at the country level to say that each country should be then having a meeting between the national drug user network or drug user organizations in the country and the country office. Now, we then, as you'll see later, we monitor the work of the high priority countries, which means we can then use our influence to then commend those countries that have taken up this opportunity and used it in a really healthy way, and to give a little bit of a push to those countries that are a bit slower to get to delivering on this task. I think people are often concerned about the challenges of engaging with drug user networks. I think people fear a sort of hard advocacy engagement. The challenge often is it's the lack of engagement that causes the hard advocacy. And when you actually start to collaborate and work together, then that stimulates a different form of advocacy, which is much more participative and engaging. Not necessarily weak, but still, definitely not weak, but different in tone. Oh, it's not moving on. And then to go to the next level, we, I think another key area, as Monica's described really ably, is this use of specialist guidelines to drive forward practice. So we come together, work collaboratively between UNODC and civil society, come up with key guidelines, support those with training toolkits, and also interestingly now with Stimulants, a specialist webinar toolkit, which you can see illustrated here. And this allows us to then turn guidelines from something that's nice and on the shelf into something tangible and practical at a country level. And what we know is that UNODC can bring together stakeholders that civil society may not convene so easily. And through our partnership, we can make use of this, the double expertise and the networks of both groupings. We also audit the work of the high priority countries, as I've highlighted to you. We've seen, we're just about to present, in fact, today, the feedback from 50 reviewers from civil society, giving feedback on 18 of the 24 countries. And again, that is about guiding the work of UNODC and encouraging and supporting UNODC to sustain and build on best practice and to develop and match that practice in countries that are maybe a bit slower to hit that benchmark. So that's it. I've included more detailed slide as follow-up, but otherwise that's for you to have after the presentation, but otherwise that's me done.
Excellent, thank you so much, Matt. And as you say, yeah, we'll share the slides so that people can also access that more detail if that's what they want to do. Really appreciate that, Matt. Thanks for running us through that mechanism. And yeah, you know, for me as well, you know, it's been a real pleasure to be part of those conversations and to see that mechanism grow and evolve and you know, really become what it is today. And thanks again to UNODC, but also to your work, Matt, in making that what it is today. So our next speaker is from a much more recently created mechanism, but I think follows a similar mold. And so I'd love to hand over now to Edith Riegler from Penal Reform International, who can tell us a bit more about the engagement that civil society has specific to the prisons work. Yeah.
Thanks, Jamie. I'm sharing my slides now. I hope you can see them. Is that working?
Yeah, that's working great.
Great. Thanks so much. It's a pleasure to be here today and to speak to this important topic. My name's Edith, and I'm a project assistant with Penal Reform International, which is an NGO working globally to promote criminal justice systems that uphold human rights for all and do no harm. And as has been highlighted in this meeting throughout, partnerships between UNODC and civil society are really crucial to make important progress in the global HIV response and to make sure that no one is left behind. So I'm going to tell you a little bit now about this informal UNODC CSO group on prisons and HIV, which has been established quite recently, and of which PRI is a member. So as we all know, health in prisons is a really neglected topic. Health services for people in prisons are inadequate in many parts of the world, and the COVID-19 pandemic has exposed the existing failures of many prison systems to meet even the most basic standards of healthcare. This is all the more true with regard to essential HIV services, which Ian has mentioned before. CSOs, and especially community-based organizations, play a critical role in responding to HIV. And engagement of civil society is especially crucial for HIV services in prison, and not just any kind of HIV services in prison, but services that are evidence-based, human rights-based, and gender responsive. And in this light, UNODC moved to establish a network of CSOs that work in prison, the first ever of its kind. Last year in October, so it's an anniversary now, this informal network met for the first time in a virtual meeting. And this meeting helped to identify some common issues that are faced by almost all CSOs that work on HIV and health in prisons, which is a lack of access to people in prison. They're a really invisible population, then a lack of data, continued stigma attached to people who have been in prison, and also crucially, political apathy towards policy change. So in this first meeting, 26 organizations took part. Now this network has grown to 30 organizations as the organizations which have received grants from UNODC have joined as well. And Tung from Lighthouse will speak to this later on. And as you can see in this graphic, there is considerable diversity in where those organizations work. Almost all regions are represented in some form, and there's also several organizations that work globally. There's also diversity in size and in focus. So some organizations only work nationally, some are regional. And I think we can all recognize that there is considerable benefit in all of those different experiences for the work of the group. So the criteria for the organizations that are part of this network are that they have experience in working on health, HIV, tuberculosis in prisons, and ideally also work with or involve individuals who have been imprisoned. But this is hard to realize, as we know. Then the aim of this group is to nurture a mutually supportive network, to be a platform that can function to exchange ideas, experiences, best practices, and especially also to share data. As we all know, data are really scarce in this field. And doing this not only on a global level, but also at the more regional and local levels as well. So going forward, the plan is to have regular annual meetings of the group, hopefully in person, as far as this is possible in Vienna. And there will also be a secretariat in the future. As Matt mentioned, there is a secretariat for the civil society group on HIV and drugs. And the plan is to have a very similar structure as well for this CSO group. So this is something that will be developed soon. Also, there is going to be a joint work plan then, where UNODC and the members of the CSO group will collaborate on all the different goals that should be achieved within a year jointly. And also to report on the work of UNODC in the UNODC high priority countries on HIV and in prisons in an annual publication. Further then, the CSO group and all the different expertise and experiences from the members will be beneficial for input to technical guides that UNODC is developing, and also to receive input on other UNODC initiatives on HIV and health in prisons. So the inception of this informal network represents a really important step, I think, in coordinating the efforts of CSOs around the globe to pool all of the different experiences, globally and local experiences, and to conclusively deliver our shared vision then of leaving no one behind in the HIV response in prisons. That's it from me. Thanks very much.
Amazing. Thank you so much. That's great. And yeah, I mean, it's great to see this this new group forming, as you said, Edith, recently. And I think if people on the call are interested in learning more about the group and you know, maybe even being involved, is it yourself that they would contact, or should they contact EHAB at UNODC? What would be the best?
EHAB at UNODC is best placed then.
Yeah. Okay. So I don't know, EHAB, if you have a moment, or if maybe one of the UNODC colleagues, if you could put a contact in the chat, I think that would be really helpful for anyone who's on this call who thinks, oh, okay, that's a group that I, you know, that's a conversation that I want to be, you know, involved in as well. But thank you so much, Edith. Really appreciate the presentation. So yeah, so we've heard from two of the mechanisms that the UNODC HIV/AIDS section that they have in place to build this partnership with civil society. And as I said, it's something that we're very proud to be supporting, and really, really, you know, it's really good to hear that those mechanisms exist. And another really important part of the relationship is obviously funding. And, you know, like, as we all know from the civil society perspective, you know, we want to play a role in all of these responses. We want to be a huge part of a response, but all NGOs require funding in order to do that. And I think with that in mind, it's great now to hand over to our final speaker, who from the civil society side. I'd like to give the floor to Don Phang Tung from Lighthouse Vietnam. I hope I've pronounced that even remotely correctly. I apologize if I haven't. But Tung is going to tell us a bit more about the experiences of Lighthouse in Vietnam of receiving funding through an open call for applications which UNODC has launched. And again, just to give us that side of how this relationship has been working. So the floor is yours. I don't know, Tung, do you have any slides you want to present, or will you just talk?
I do have a slide, thank you very much, but
okay.
I'm trying to screen it, but I don't know what happens with my new computer, so it could not screen at the moment. So I can ask the help from UNODC if you can help me just to screen my slides.
Or maybe Sarah, do you have a copy of the slides that you could maybe share on Tung's behalf?
Yes, just give me a second to open the correct set of slides.
Okay, so Tung, over to you, and then we'll get the slides up as soon as we're able to. No problem at all. Thank you.
Thank you very much. Yeah, so hi everyone. My name is Tung, and I'm Executive Director of the Lighthouse Social Enterprise. and CBO led by and working with the young key population and LGBTIQ people in Vietnam. And I'm so proud to be here today and share with you about the partnership between Lighthouse and with UNODC. I think not only with the HIV grant for the civil society, but also the partnership in terms of advocacy and also in the raise the voice of people who use drugs in Vietnam and also in the region. So yeah, I saw my slides ready. Thank you.
Yeah, if it's just possible to make it full screen. I don't know if that.
I think so.
I think, yeah, I don't know, Sarah. I think Sarah's trying to. Anyway, carry on. We'll try and get that presented with full screen for you.
Yeah. So I just introduced about the Lighthouse. So we aim to create a future of better health, equal rights, and sustainable development of for all LGBTIQ and young key population, including people who use drugs. So let's move. Yeah.
Sarah, we seem to have lost the slide. Or the slides, rather.
Sorry, my Zoom app just broke down when sharing slides. I was trying to do that again.
Okay, sorry. Continue to.
Yeah. So so let me tell a little bit about the history of Lighthouse. So we the first established in 2004 as self-help groups. And then we do a lot of work about the HIV preventions and treatments and support for the key populations in Vietnam and people living with HIV. And in 2016, we officially registered as a social enterprise. It's also the way that we can sustain our activities and expand our collaboration with the other organizations and working for the community. And in 2020, we opened our first community clinic to provide the comprehensive services, including the harm reduction services for the LGBTIQ people and key population who use drugs. In this year, we also have the opportunity to collaborate with UNODC to implement more work for the high fund community in Vietnam. So in 2019, we first conducted one high fund study or CAMSEC study among the community in Vietnam. And we found a lot of the inequalities and also in the issues and concern from the high fund community. It is a lack of the information. It is a lack of the services, appropriate services that they need, and also the high stigma and discrimination against the people who use drugs in the healthcare setting. And in parallel, that the people who use drugs and also high fund community, they also have the high self-stigmatization themselves. That is really big barrier for them to access the needed services. And we also found that there are very few people who access to the PrEP services, and it seems that PrEP is playing very important roles to to help the high fund community to protect themselves. Yeah, I think the next slides.
Yeah, I'm hosting these now, so if you just let me know where you need me to go.
Yeah, next slide, please.
Yeah.
Yeah, I think I go through this slide already, but I do want to mention about the community-based participatory action research. That is the reason why we the first conducted the high fund study to gain more evidence and also the to collect the community input and also community voices to strengthen our programs and also to advocate for the community. And then we also trying to put community in the center to collect their ideas and also to know about what is the real needs of the community to deliver better services for them. So can you go next slide, please? Yeah, so this is some pictures of the Lighthouse teams. We have done a lot of activities to engage community, also to empower community themselves with the knowledge and tool and skills. And now we are very happy to see many new and young faces joining with Lighthouse teams to deliver services and to educate community with the good knowledge. So next slide, please. Yeah. So if you can see here, we actually have been working with UNODC in Vietnam for a very long time ago. We're joining in the advocacy efforts to advocate for the more appropriate law and policy within the HIV field, and also drugs preventions and also harm reduction services. However, we have never received any funding from UNODC. And you know, in the early of this year, in late of 2020, we received a lot of information from UNODC HIV grants for civil society organization from our college, from the Asia ChemSec platform. We also received it from the colleagues from Youth Lead, and also the other social media platforms. So it was shared widely among the network and platform, and I feel like it's very easy to access information about the grants. And then after that, we also analyze carefully the details of requirements, and the UNODC also provide very clear guidelines for the applications. Like how we can apply for the grants, how we can address the key questions in the proposal. So after that, we also complete the narrative proposal with the finding from our study, but also we conducted several community consultation to get more information and update information from community themselves. We also complete the budget with the UN's cost norm guidelines and the other required form. And I feel like it's quite clear for anyone who interested to apply for this grants to complete the proposal and also the budget. And after the, a few, I think a month or more than a month, so UNODC team contacts and justify more information from our proposal, and also discuss about some key component in our proposed projects. That is very great because we can explain more than in the paper just said. So we can tell them more about the realities of community in the countries and how we need more activities and more intervention for community here. And afterwards, UNODC provide a very clear instructions for recipients on the agreement signing, on the reporting process and key contact persons. In here, I also saw Anh Cường from UNODC Vietnam, who were technical persons and support in our projects very closely with our projects. And then we implement the projects with useful technical support from UNODC Vietnam, and also we join together to involve in the national discussions on HIV and drugs. I will tell you more in detail in next slides. And we also joining in the technical meeting and also receive the updates from UNODC about what happens in the region and in the world related to the people who use drugs community. And next slide, please. Yeah, so let me tell a little bit about our projects. Like I said before, we found that the high fund community, they are really less likely access to the PrEP services. We found that only like about 30% of them have had access to the PrEP services before, and just half of them still remained in the PrEP programs. So we start on projects to promote for the PrEP and also to bring the PrEP to the high fund community and make sure that they can access it without any barriers and any uncomfortable environments. So the project will be implemented in the 2021, and we've really focused on young ChemSec users from 16 to 30 years old. And specific aims of the project is trying to enhance the capacity of the ChemSec peer educator. I would say this is one of the first project. It's really focused on Hiv and ChemSec community, and we are very new in this area. When many other organizations, they most focus on young MSM in general, but we think that we need to have more specific strategy to address the HIV needs of the LGBTIQ and MSM and trans community who use drugs. So this ChemSec peer educator will play a very important role to provide more information on harm reduction for community. And we also increase the ChemSec community awareness and knowledge on PrEP in combination with the HIV prevention package as a very comprehensive approach. And we also link about 200 MSM who engage in ChemSec to PrEP services, the other HIV and healthcare and harm reduction services. And next slide, please. So to illustrate more concrete about what we are doing right now, so we run a social media campaign on PrEP for the Hiv and ChemSec community. So we have the Lighthouse one-stop shop clinic, and we're trying to promote more and more messages and positive messages about PrEP and people who use drugs and Hiv community on our fan page. And we also develop a particular and dedicated fan page for Hiv community, and you can easy to search it on Facebook. So we're trying to change the approach, not by the other health institutes. They mostly and often approach the community by clinical information and technical information, but we're trying to approach them like being a friend with the community. So we're trying to use the storytelling, we're trying to use the real story from the community and provide them the closest information that relevant to their life to make sure that they feel comfortable when they receive the information. We also organize a different live stream and brings the faces of community and people will feel more familiar and easier to access the information and services. Next slide, please. And in here, we also outlined several differentiated service delivery methods. We provide some mobile counseling for community because in Vietnam, we faced with the COVID outbreak. So we're trying to provide more like online counseling for community to make sure not only focus on drug, but also focus on mental health care and support them when they feel lonely, when they feel like isolation from their family. So they have someone to talk with. We also provide the online counseling on the gay dating apps. We reach many people in there and a lot of people, they need the help from our peer educator. With the Lighthouse Clinic, we also deliver the PrEP with a very friendly way and also trying to distribute the COVID and HIV package to the Hiv community. And from then and until now in October in 2021, we provide more than 700 counseling sections online through mobile and online in our fan page. We also provide the HIV testing for more than 370 people. We already enrolled about 150 people on PrEP programs and 17 people enrolled in ARV treatment. And we also provide the STI testing and treatment for more than 200 Hiv community. And within our peer educator groups, we also organize several internal training for them to update the new information and so new matters that they can and better support to the community. Please go next slide. And lastly, partnership with Unodc, not just only like a donor and recipient, but we are more than like partners. So we have done a lot of collaborations recently. As you can see in here, Lighthouse also joined with Unodc in Vietnam to develop a national guideline on harm reduction for MSM who engage in chemsex, and it's officially endorsed by the VAAC, the Vietnam Administration of HIV/AIDS Control, and we still need to continue advocate to apply this harm reduction guideline in the real world, in the other health facility and CBO. I also joined with the UNODC in the consultations meeting on the draft decree guiding of the implementation of medical aspect in the amendments drug law. So we found there are a lot of the issues faced by the community when this amendment drug law will be applied in the medical facilities. So we're trying to raise that voice in the consultation to make sure that we be included and will be heard by the governments. And yeah, Lighthouse also working with the Global Fund to produce the chemsecondase harm reduction guideline. And I want to stop my presentation by the last slide with a strong message that we're giving her and stop it together. Not only UNODC, Lighthouse, but the other participants in this webinar today. Thank you very much.
Thank you so much, Tung. That was fantastic. And yeah, I mean, that's just, I really like what you were saying about it's not about UNODC being a donor and you being a recipient, but your partners in this work as well. And I think, you know, over the years, UNODC have been able to give dozens of these kind of small grants to partners, and hopefully that's something that will continue, you know, with future calls in the future. So do keep an eye out for those as well. So yeah, thank you so much to all of our speakers from UNODC and from civil society. We have a few moments now just to tackle some of the questions that have come in. And I've tried to keep an eye on the chat at the same time as well. So I think the first question, so we've had some comments from Alicia from EDEI in Argentina, who is keen to discuss and promote the work that they're doing with adolescents and adults. So Alicia has shared the link there, which hopefully UNODC colleagues can then capture and follow up. And what I would say is, Alicia, if you're able to share an email address in the chat, then UNODC colleagues can also follow up with you separately on that. One of the questions come in from Militin is, it says, thank you for presenting all the good work in prisons, but as one of the key global AIDS strategy, one of the key goals of the global AIDS strategy is to keep people who use drugs out of prisons. What are you doing on that issue, on that part of the work as well? So not just when people are in prisons, but also keeping them out of prisons. And then we also have a question from Ghana, from Umar Adamu from Ghana, asking about the use of illicit drugs for people living with HIV. Does it have, what impact does it have on the virus? That, you know, I don't know if you're able to answer that question. And also because people who live with HIV often use more local medications, you know, what the effects might be to the healthcare system over there. It's a much broader kind of HIV question, if you're able to answer that. So maybe if we take those two for now, and then we can see if any other questions come in. So Fariba, I'll allow you to kind of navigate with your team through those questions.
Thank you. And thank you for all the interest and all the questions. It's really great to see that, you know, people our partners are asking, you know, questions and getting involved in the work that we're doing. This is really great. Regarding, you know, what we are doing on keeping people out of prisons, this is a very, very important part of our work to advocate, and this happens at all levels, you know, within senior management right to the working level, that we do not promote putting people in prisons. The message from UNODC is always alternatives to imprisonment and to reduce overcrowding in prisons. You know, this is also in all the outcome documents, in all our policy documents, it's everywhere. And the HIV/AIDS team, the justice section, we also have our prevention, treatment and rehabilitation section. We are all working towards, you know, making this advocacy clear at country level that we do not recommend putting anyone in prison. So this is the work that we're all doing together with our CSO partners, of course. So I don't know if Monica and Ihab have anything to add on this point. I think Monica wants to also say something. She's nodding.
Yes, thank you, Fariba. I mean, you, as Fariba and Ihab and mentioned, support for the member states to develop legislation that provides an enabling environment for the implementation of harm reduction services is very much part of our work. Following the adoption of the outcome document of the UNGAS in a special session in 2016, where it's very clearly mentioned that countries are looking more into a public health approach to and the human-centered approach to solve the drug problems. Many countries are changing their legislation to enhance this. One example that I can give is Myanmar, where our colleagues and us, the team here, supported very much the development of the new legislation that specifically mentioned harm reduction. Another intervention is something that we mentioned very briefly is to work with the law enforcement. To train the police officers on the street to understand the needs of people who use drugs and to develop referral programs so people will not be arrested for carrying small quantities or harm reduction paraphernalia, but should be referred to centers where they can receive either treatment or harm reduction intervention. So this is another activity that we are developing in all the high priority countries. And of course, I think Ihab can talk more about alternatives to imprisonment.
Thank you. Ihab?
Well, thank you very much. I think it's well covered by Fariba and Monica. The only thing I would add here is there's two sets of countries where the policy is not there. I mean, policy for alternative to imprisonment, and others it's there, but it's not functioning well. Even this is also in some developed countries as well. Anyways, so what we do, as Fariba said, that we promote the development and the implementation of policies that will allow for alternative to imprisonment and incarceration for people with minor crimes or offenses, including people with drugs, of course. This is very important. And I would say that this became very clear and obvious even during the COVID-19 that we had to do this. We had to bring back the long-standing call for alternatives that the UN has been calling for a long time to keep people outside prison settings. So COVID was again bringing this to the heads of people. And yeah, so this is the situation right now in this regard. And what we do is in line with the international standards, including, of course, Jamie, you know, the 2016 outcome document and all relevant GA documents. Thank you.
Okay.
Just to add, Jamie, I just also want to add that we have the UN Common Position on Incarceration, which is a very, very important tool to use, you know, because this is a joint common position on what the UN thinks about incarceration. So this is a very important tool that we can use for advocacy at country level. And as we have mentioned, you know, right at the beginning of the COVID pandemic, what we did, we had a joint statement on prisons and incarceration that was jointly signed by our principal together with the WHO, UN AIDS, OHCHR, and I think UNDP also was involved. I can't remember who else was there, but this was also a very important statement that came out right at the beginning, asking, you know, countries to make sure, you know, because to reduce overcrowding and to address the prison population also in their COVID response, because this was a population group completely forgotten. Just to clarify.
Thank you very much. I've just put the link to the common position on incarceration. I've just put that in the chat. for people who who might be interested in reading that, because I agree it's a great document to move forward. There's also a UN common position on drugs as well, which I'll put in the chat in one moment as well.
Yeah.
So I think we've got time. Just one last question. I see that Alicia is also continuing to share information about the EDEI services in Argentina. Alicia and lots of other people have shared their emails in the chat, asking for follow-up and maybe to see in what ways they can work with your team. So we'll capture that chat and make sure we provide all of those emails so that UNODC colleagues can follow up with Alicia and with other people directly. The last question I can see here is from Reiko. I believe that's how it's pronounced. It says, well, it's a long question, but basically it seems that UNODC and WHO as multilateral UN agencies occupy an interesting place in harm reduction related interventions. How has that role evolved over time? And could you say a bit more on the importance of UNODC's regional offices? That's actually a good point. We haven't really talked much about the regional offices. So yeah, just maybe a few comments, Fariba, and maybe from your side, Matt, as well, just about how that's evolved over time, UNODC's role on harm reduction as part of that response, and what role the regional offices also have.
Just quickly, Jamie, I mean, the role of UNODC, we have been a co-sponsor of UNAIDS since 1999. Mm-hmm. We were one of the first agencies who were asked to be a co-sponsor because of our comparative advantage on how to address HIV among people who use drugs. Because of the partnership that we have at the country level with drug control agencies and drug policy makers. So we have been working on harm reduction since 1999. When I joined UNODC in 2000, this is one of the things that I was very much involved with at that time. So we have been working, especially in countries where the epidemic was driven by people, by injecting drug use. So we have been involved in harm reduction. We have been, working with our civil society, with WHO, with other interested agencies in, advancing the harm reduction agenda. And I think we have, reached quite positive outcomes over these many years. And Matt, I think you can also speak to this because you were also one of the pioneers of the harm reduction movement. And regarding our regional offices, we have, of course, we have regional offices, and some of my colleagues are actually online now. Karen, who is covering the Southeast Asia and the Pacific. We have Faisal, who is in Eastern Africa regional office, and other colleagues who might be online, and they have a very prominent role to provide assistance to the countries they're covering for the work that we're doing. And we work very closely with them, and they have a very important role to play. I don't know if any of them want to come in and say something about the role that they do actually play. I stop here because I know we're running out of time, and give over to Matt. Thank you.
Matt, did you want to?
No, I'm not sure I can add much more, really. I agree that, the UNODC Global HIV Program has always been a key champion of harm reduction within UNODC. I think the comfort of the wider UNODC system around harm reduction is growing, and I think the HIV team's been a key catalytic part of the UN system. And I think also the civil society advocacy has been very powerful. I think what we've strengthened in the last 8 years is not the commitment to harm reduction, but the commitment to civil society participation. And then that allows for a much more nuanced debate and effective partnership working, which then turns words into action, which then makes us all much more effective.
Thank you so much, Matt. So yeah, I think as Fariba says, we're at the half-hour mark. So I think we're at past. So thank you so much for everyone for joining us today. As we've already said, we will make sure that the recording is available. We have attempted to record this in all 4 languages. So hopefully we'll have all of those available for you to share and for colleagues who weren't able to join us live. We'll also provide, we'll share those presentations. All of this will be on the Vienna NGO Committee website, vngoc.org. And as I said, UNODC will provide the email addresses in the chat so that they can follow up directly. But just for me to say thank you so much to all our participants, to our translators today for helping us deliver this session, and especially to our speakers from both UNODC's HIV/AIDS section, but also from our civil society partners from Matt and Edith and Tung as well. Thanks so much for joining us and giving us these wonderful, really interesting perspectives. And yeah, let's continue this partnership, and looking forward to hearing more in the future as well. So thank you so much, everyone. Thank you.
Thank you.
Thank you, Jamie. Thanks, everyone.
Bye.
Thank you. Bye.
Bye.
Thank you. Bye.
Thank you. Bye.